Good morning, everyone. Welcome to the webinar on addressing domestic violence in LGBT2SQ plus communities across BC. Just as we get going this morning, there are a few people logging on still. If you could just message in the chat and let me know if you can hear me. Great, thank you so much. So we'll be spending the next hour and a half together until 12 o'clock. And my name is Kate Rossiter. I'm the Research and Project Coordinator, Manager at the Ending Violence Association of BC and the Safe Choices Program Coordinator. And I'm very pleased to welcome our two facilitators for this morning's webinar, Olivia Fischer and Daley Laing, who've both been with the Safe Choices Program for quite some time. And so I will now hand it over to them to take you through the webinar. And if you have any problems along the way, please use the chat function and I'll problem solve with you as we go. Thank you.
Hello, everyone. Turn off the sound. Excellent. So my name's Olivia Fischer, and you'll be hearing my voice throughout. We have folks joining us all across BC in various sectors and organizations. And before we get into the content, we always like to begin with a land acknowledgement. And while this is always very important to our trainings, it's particularly important given the violence of colonization that has occurred historically and is present today. So with that, we respectfully acknowledge that we are facilitating this webinar on the unceded and ancestral lands of the Coast Salish people. And we also wish to acknowledge the Indigenous lands across the province in which participants are presently located. Just give a brief introduction to our organizations. So the Ending Violence Association of BC, or EVA, is a provincial nonprofit umbrella organization that has existed in BC for over 27 years and is funded predominantly by the province of BC to serve as a resource for over 300 community-based programs and initiatives supporting survivors of domestic violence, sexual violence, child abuse, and criminal harassment. The Safe Choices program is part of EVA and has been in existence for over 20 years. And we're funded by the Vancouver Coastal Health Region. And this program focuses on preventing violence in LGBT2SQ people's intimate relationships. We offer service provider education workshops, which we'll be talking about today, and that's where the content will be coming from. And we also offer healthy relationship workshops where we actually go into the community and speak to folks about communication, sexuality, and how to have healthy relationships. Today's webinar is funded by BC Ministry of Public Safety and Solicitor General through a Civil Forfeiture Grant, and we're very grateful for this funding as this webinar has been a dream of the program for many years now. A little bit about us. So my name is Olivia Fischer. I use she, her, and they, them pronouns, and I identify as queer, non-binary, and a white settler. I live and work on the unceded territories of the Coast Salish people, and very recently I finished my MA in counseling psychology at UBC. My thesis was focused on trans reproduction, specifically non-binary folks' experiences of conception, pregnancy, and birth. And I've been with Safe Choices for over 4 years as both the assistant coordinator as well as coordinating workshops.
Hi there, my name's Daley. I'm the other voice on the line today. My pronouns are they, them. And I'm a white, disabled, trans facilitator. And my work focuses on accessible anti-oppression of form supports for both individuals, groups, and organizations. I have over 15 years of nonprofit experience, and for me, that really centers a lens of compassion and curiosity of like how we do the work of building capacity, transforming our organizations and ourselves as individuals. I'm currently living on the lands of the Coast Salish people, but I grew up on Treaty 6 land, which is often referred to as Edmonton.
So some brief housekeeping. So all attendees are muted during the webinar. If you are experiencing issues, please type into the chat box and Kate will try and help you out with that. If you have a question for the webinar series or for the speakers throughout the talk, please enter these also into the chat feature, and we'll be collecting those and answering and addressing those at the end of the webinar. We're going to spend approximately 15 minutes working through those. And after the webinar is complete, you're going to receive an email with a link to an anonymous evaluation survey. We really appreciate any feedback you have, as well as all the presentation slides that you'll be seeing today, and a link to the webinar recording. So you can visit this after or send it out. With that, we are mindful that we are going to be presenting a lot of information today, as well as some self-reflection questions. So we'll be pausing throughout so you can digest and reflect. And don't worry about catching everything, because you can go back. You will have those materials. And some of these topics may feel unfamiliar or uncomfortable, and we recognize that we all bring biases to this training. So we just really encourage that you keep an open mind and be mindful of these biases as we move along. What we're hoping that you'll get from today's webinar is first that you will learn some up-to-date information about the prevalence, unique issues, and dynamics of violence and abuse in LGBT2SQ people's relationships. And ideally, after this webinar, you'll know more about how to respond effectively with greater knowledge, sensitivity, and skill when supporting LGBT2SQ folks experiencing this issue. And finally, we hope that you learn more about addressing risk and safety within this population. You already know a lot of how to work with your clients and your populations, and we consider this to be an expansion pack. So to build off of the many skills and techniques that you already have with some additional considerations for working with queer and trans folks. A brief look at what we'll be talking about. We're going to begin with some language and terminology and just cover the basics. This is not going to be an exhaustive list, but is often the piece that a lot of folks are quite eager to learn more about. We'll have a quick poll to test your knowledge and introduce some key concepts, discuss research, cover the rates of intimate partner violence within these communities, discuss abuse and what this can look like within intimate relationships in LGBT2SQ communities, discuss intersectionality as it pertains to this topic, look briefly at health, justice, and victim services. And then we're going to give you some practical suggestions, considerations, and resources, which you can refer to after this presentation, and things that you can actually apply to your work to increase your readiness. And then we're going to do a closing and evaluation.
So we're going to start with language and terminology, which I think can give us a really good foundation for a lot of what we're going to talk about today. But when we start with language, we want to sort of start with what we call the terms paradox, which is that terms are crucial and terms are also meaningless. And so for me, it's a starting point. What we do with language, how we act, the actual things we do in our practice matters just as much. And so if we learn the language, but we don't also learn a lot of what else we're going to cover today around like practical ways of enacting this knowledge, we're really not necessarily providing the support that folks need. So as we go through language, I want to encourage you to think about this as a starting place, and also remember that language changes over time. And we really want to mirror the language that the people we work with use. So if someone uses a term for themselves, let's really center their agency, their autonomy to define their experience and their words for themselves. So let's start at the top. The first term we want to cover is sex assigned at birth. This is the term that we use rather than biological sex, because it really acknowledges that sex is a medical category. And so it's a category that's assigned to you when you're born, generally based on your external genitalia. And sex is quite limited. It generally only functions in a binary where you will be assigned male or female. And I think anyone working in services knows that binaries generally don't work if we only have two options, and sex really doesn't capture the diversity of human bodies. And so just to be cautious that sex is sort of a category that can be limited, and that there's lots of folks that don't fit into those two options of male or female. And so this is sort of like an important term. Within this is the term of intersex, which refers to someone who doesn't fit into the sex category or the biological category of male or female. The next term is gender identity. And the way that I think of this is it's your experience of your gender. So it's both your identity, like a cognitive thought of who am I, but it's also an embodied experience. It's like how gender feels in your body and what's true for you. And to acknowledge that gender identity can be fluid over time and is much more diverse than the sort of normative categories of men and women, that there's a lot more identities beyond being a man or being a woman. And when we have this idea of gender identity, we can sort of get three key terms that relate to the relationship between your gender identity and your sex assigned at birth. So the first term there is cisgender. So if the sex you were assigned at birth matches your experience of your identity, so an example would be you're assigned male at birth and identify as a man, you're considered to be cisgender. The same could be said if you were assigned female at birth and identified as a woman. The term we would use for you is cisgender. What's important to grasp about the experience of being cisgender is it's often what we assume. So we assume people are cisgender, we assume their gender identity is going to match their sex assigned at birth, unless people prove otherwise. And so in society, it can give more privilege to that identity category. If cisgender is matching sex and gender identity, transgender refers to when your sex assigned at birth and your gender identity do not match. So an example would be you're assigned male at birth, but you're a woman. Or you're assigned female at birth, but you're a man. And this is an umbrella term. Not everyone will use this term for themselves, but it's sort of meant to capture when those two categories are not aligned. The third term we have in here is just to acknowledge that there's more than just the binary that's operating in cis and trans experiences. So the term is non-binary, and this refers to gender identities that exist outside of the binary. So this could be you identify as both masculine and feminine, or like myself, I identify as neither masculine nor feminine. And so it really starts to make us question the very binary, the ways that those sort of two categories of masculinity and femininity are put in opposition to each other, and really starts to make us really feel the fluidity of gender identity. The next term is gender expression. And gender expression is how we express our gender. That can be clothing, it can be behavior, it can be your mannerisms, your voice, even how we relate to people often is coded as gendered in our society. And what I really want to remind you of or get you to hold really dear is that you cannot tell someone's gender identity based on their gender expression. And there's sort of two main reasons why how we express our gender might not match how someone's reading it. The first is we're not always safe to express ourselves. There are situations where, expressing your gender identity might make you less safe. It might make services less accessible. And one of the beautiful things is like trans and gender diverse people, we've survived a very long time and we're quite skilled at it. So there might be reasons why we're not expressing our gender in a way that matches our identity. The other reason to not assume someone's gender identity based on their expression is that you might actually be reading the expression incorrectly. So the assumption that if someone's wearing a dress, they're feminine or identify as a woman might not be true. There might be a lot more reasons why a dress feels like the right expression for them. And so we really want to be cautious about making assumptions about someone's identity based on their expression. The last term on this slide is sexual orientation. And it's really important to not conflate sexual orientation with gender identity or gender expression. Though gender may play a role in sexual orientation, we don't want to, start to make sort of rules or assumptions about how they go together. Because sexual orientation is really about attraction, and that can be emotional, it could be romantic, it could be sexual. And sometimes that's about people's genders, and sometimes it's not. I think what's really also important is to acknowledge that not everyone experiences attraction. So within sexual orientation, we also want to name the term asexual, which may be no forms of attraction or only certain forms of attraction that someone experiences. And we really want to be cautious about assuming sort of that everyone experiences attraction. The other term that we wanted to give a whole slide to because it's really important is the term two-spirit. Two-spirit is an umbrella term, and it's used by some Indigenous people who identify as having both a masculine and a feminine spirit. And what's really important about this term is that it's a term that Indigenous people created for themselves. So it's not a term that's been applied to them, it's their own term for themselves. And I think one of the things I like to highlight when we talk about two-spirit is that we just discussed a bunch of categories that are sort of built on more of a Western or Anglo model of gender and sexuality, and to be really cautious of trying to squeeze two-spirit into that structure. As is said by the quote at the bottom by Dr. Sarah Hunt, the term two-spirit is popularly used by Indigenous people to identify a range of roles and identities, which may span and even complicate distinctions between gender, sex, and sexuality. So when we're trying to be cautious of colonization, we need to be cautious of what assumptions we're making about the term two-spirit based on a more Western model of gender and sexuality. There's one term that's not on a slide that we are going to use, so we want to name it, so you're not like, you didn't say that and now this word is popping up all over, and that's the word queer. Historically, queer was a slur that was used against LGBT2SQ folks, but it has been reclaimed by a lot of people in the community. And when we use it, we're referring to people whose gender or sexuality is outside of the norm. And when I say norm, and if you're curious about how do we like identify what the norm is, for me, it's like, what assumption are we making? And so when it comes to sexuality, generally we assume people are heterosexual unless they come out. So the norm or the assumption is heterosexuality. Same with people are assumed to be cisgendered, right? That their sex matches their gender identity, unless they sort of say or prove otherwise. So just thinking about what are the assumptions we make is a really good way to like gauge what's considered the norm or the assumed position in society. So based on these ideas that there are assumptions that we have in our society, we wanted to take a look at some of the myths that might exist about LGBT2SQ plus intimate partner violence. And we wanted to do that by actually asking you some questions. So what we're going to do is we're actually going to send out a poll to you. It's going to pop up in sort of the same area where your chat is, and we'd love for you to answer based on sort of what you think is true or false. And this is based on the work of Messenger, who is looking at some of the like assumptions that are made about LGBT2SQ plus relationships. So the first one is true or false. Intimate partner violence in LGBT2SQ plus relationships is less than intimate partner violence in heterosexual relationships. So you can go ahead and answer the poll. Give you one more second. So the answer is that this is false, and that actually intimate partner violence is more prevalent in queer and trans relationships. So the next question we have for you, or true or false, perpetrators of intimate partner violence in LGBT2SQ plus relationships are more often masculine presenting. True or false? They're more often masculine presenting. So this is also false. So a common assumption in the work that we do is that intimate partner violence is a like cis man or a masculine person harming a cis woman or a feminine person. And that really doesn't make a lot of space for us to talk about like harm that happens in relationships where there's two feminine people or two women or two masculine people. And I think what we need to acknowledge is, and we'll talk a little about the other factors that are at play, but there's a much more complex relationship of power and privilege than simply masculine and feminine that exists in LGBT2SQ plus relationships. So the last question we have for you is LGBT2SQ plus intimate partner violence is the same as heterosexual intimate partner violence. Is this true or false? Is the intimate partner violence the same or not? True or false? So this is also false. While there's a lot of similarities across sort of heterosexual intimate partner violence and queer and trans intimate partner violence, there are some particular dynamics and ways that queer and trans people may be targeted, like specific ways that harm shows up. And also there's specific barriers that exist for them in accessing services or accessing support on different levels. So while there's a lot of similarities, there's some really important differences that we need to acknowledge.
And with that, we're going to be talking about some of the rates of IPV in this particular community. And some folks are often quite surprised to learn that lesbian, gay, and bisexual people are twice as likely as heterosexual folks to experience IPV. So this is within the sexual orientation realm. Within gender identity, trans folks are almost twice as likely as cisgender people to report ever experiencing intimate partner violence. And then QT BIPOC, which stands for queer, trans, Black, Indigenous people of color, and Two-Spirit folks, who Daley defined earlier. They're very underrepresented in research, but definitely experience higher rates of intimate partner violence and a lot more barriers to support. We are just not asking these questions in surveys, so we just don't have that information. 1 in 3 lesbian, gay, and bisexual people report emotional and or financial abuse, and 1 in 5 lesbian, gay, and bisexual folks report physical and or sexual violence. So these rates are very, very high. And then 1 in 2, so 50% of trans people report ever experiencing physical and or sexual violence. Another group that isn't represented on this slide, but is very important to talk about, is bisexual women who experience the highest rates, and they experience 60 or 61% of them will experience intimate partner violence in their lifetime. And this is due to a lot of the negative stereotypes that surround bisexual women in particular, but also around bisexuality, and there's a lot of questioning about the legitimacy of their identity. So we want just to take about 30 seconds for you to reflect on why do you think these rates are so high? And some factors that have been identified that are underlying this issue and that are contributing to these high rates are of perceiving society to be discriminatory or experiencing a hate crime. So previously having negative experiences and looking to find power in any way possible. And what that can lead to is seeking power within intimate relationships. Similar to that, if someone has experienced discrimination from services within victim services, the justice system, even amongst their family and friends, they may be less likely to seek help. It's confirming, they don't want to confirm that they will be less supported because of their sexual orientation or gender identity. If someone has internalized societal views of homophobia or transphobia, they may feel deserving of abuse. They may be very down on themselves and therefore be more likely to be victimized. And finally, if someone has a low degree of outness, so they haven't come out to their friends, family, coworkers, etc., they may be more vulnerable to threats of outing. And it's always important to talk about some of the limitations behind some of these rates and statistical research. So number one is there's very limited research and funding. Only 3% of 14,200 articles published specifically on IPV between 2000 and 2015 actually focused on lesbian, gay, and bisexual folks, and that's not even including trans and non-binary people. There may be a reluctance to disclose gender identity, sexual orientation, and or experiences of relationship violence and abuse. There's a lot of social stigma that surrounds both gender identity, sexual orientation, and intimate partner violence, and this twofold may make people reluctant to identify this on a survey or to go speak to a researcher. There's varying definitions and measures, and this limits understanding of who is actually perpetrating and experiencing intimate partner violence. So a lot of these measures are based on heterosexual cisgender intimate partner violence and leads us to miss a lot of important categories. So for example, let's say a bisexual woman indicates on a survey that she is experiencing intimate partner violence, but there's no box to indicate the gender of her abusive partner. So it's impossible to tell who is actually perpetrating this violence. And if it falls within queer and trans intimate partner violence, well, it does, but we just don't know the specifics of that. And there's also small and unrepresentative samples. So this fails to reflect the diversity. It's a beautiful diversity of LGBT2SQ folks in their communities and is often taking place in very small organizations. And that's often people who are accessing services already. And very importantly, there's very limited intersectional analysis of victimization and perpetration. We know very little about the experiences of trans and gender diverse people, QT BIPOC, Two-Spirit folks, and those living with disabilities. So we have another self-reflection question for you, and that's how might abuse in queer and trans intimate relationships look different than abuse in heterosexual relationships? Daley covered that in the polls, but if you're thinking and you know that, okay, it does look different, what might be some ways that that would actually occur? I'll give you about 30 seconds to think about that.
So building on this information we've shared around prevalence and also some of the limitations of the data that we have, we wanted to spend some time actually talking about abuse. And I'm sure that lots of folks on this webinar have like a definition of abuse that they're using, but we love to just sort of start somewhere so we are all on the same page. So for us, we're using the definition that abuse is a pattern of behaviors that may be used to intimidate, isolate, dominate, and or maintain power and control over someone, often done by removing choices and options. And when we talk about LGBT2SQ plus folks, we want to acknowledge that all forms of abuse can exist in their relationships, and that includes emotional abuse, verbal, physical, sexual, spiritual, and financial. So that queer and trans folks can experience a whole wide range of abuse. This is the power and control wheel. This is often a common tool that people have already seen if you work in intimate partner violence. But what's this one has been adapted to look specifically at lesbian, gay, bisexual, and trans relationships. And this can highlight ways that queer and trans folks may be targeted. So I like to use the language of targeted instead of vulnerabilities. We're magical, wonderful humans, so let's focus on like how people, perpetrators are doing harm instead of thinking of us as necessarily being vulnerable. And I want to just point out the 3 different layers of this wheel. We're going to go through each of the little pie sections, but just to acknowledge the structure of it. So in that center piece that looks like pieces of pie, those are sort of practices of power and control that don't necessarily get acknowledged as much. So they're not the physical violence, but emotional, psychological, financial forms of abuse. Then there's that sort of small white circle, and that really acknowledges that we also experience physical violence. So sexual violence, hitting, shoving, kicking, assault, all of those things. And I want to then take our acknowledgement to the outside circle. And Olivia sort of talked about the social context of like why our prevalence is so high, but to really acknowledge the systems that we're living in, such as heterosexism, homophobia, biphobia, transphobia, and how those systems really impact and play a part in how we experience intimate partner violence in our individual relationships. So let's look at some of the specific areas in which queer and trans folks might be targeted. So within the category of using coercion and threats, there's the chance of threatening to out someone to their family, to their friends, to their employers. And this may be outing your sexuality, might be outing your gender. And this is a really substantial threat that people may lose family, they may lose work, they may lose friends. And often for us, we're already experiencing levels of isolation, which we're going to talk about. So this is a really powerful threat. Under using emotional abuse, intentionally misgendering or dead naming their partner. So misgendering refers to using the wrong gender for someone and doing it intentionally. So the example would be if I'm non-binary and my partner is always telling me that I'm a woman because I was assigned female at birth. And this can be an act of like making me doubt myself and really like, again, that reducing options, feeling like I'm not real or that people aren't going to see me and support me if I leave this relationship. Dead naming is a term that refers to using a name that someone no longer goes by. This may be the name they were given at birth or just a previous name. And again, this is about being intentional. It's about saying to someone that like your identity, your experience, who you are isn't real and valid, which prevents us from seeking support, but also may support that idea that Olivia mentioned of internalizing and thinking that we deserve the harm that we're experiencing. Using isolation. So within queer and trans relationships, folks may cut their partner off from accessing safe spaces and the queer and trans community. And often these are really important places for people to like explore themselves, grow and change. And so an example of like not being able to hang out with other trans folks, where you might learn that like the way that your partner treats you isn't the norm, or like these are not actually part of queer and trans relationships. And we're already experiencing a lot of isolation, so this can be quite acute form of power or harm within our relationships. So this is a quote from Tales from Another Closet, and Lisa said, "Kim told me that my mother would never accept us and that she would try to break us up, so I saw less and less of my family." So this idea of sort of isolation combined with being outed as a way of maintaining power over someone. So looking at some more specific ways we may be targeted, denying, minimizing, and blaming. So an example is reinforcing myths that women can't abuse women. We sort of touched on this in the poll, that like femme presenting or feminine folks can abuse other femme people, and often that's just like not the story that we're told, so people won't even identify it as violence. Denying the existence of a relationship. So, you know, like not, the example being if you're not out, right? Like denying, well, we're not even together, so how can this be domestic violence? Because I'm not your partner. And that includes like saying a person is just the roommate, like really denying, right? Like sort of that sense of gaslighting, really rejecting someone's sense of reality, which really can do harm to someone. Another example is using children. And we see this outside of queer and trans relationships, but specific to LGBT2SQ plus folks. There's the chance that someone may be instilling homophobic, biphobic, or transphobic thoughts in their children. So actually making your children contribute to the harm that you're experiencing. And then the last on this slide is using privilege. So often, we're going to talk about it, is the sort of intersections of identity. And even within queer and trans relationships, different folks have different amounts of power and privilege. And that can impact the dynamic that exists. So an example would be using a lack of knowledge of legal rights to reinforce power and control. Like, oh, if as a trans person, if you leave, like you won't be able to take the kids because trans people will never get their kids, or things like that, that claim authority to a system that someone may not have a lot of power in. Yeah. So here's another quote. This one is from David, who is a survivor of intimate partner violence. Apart from my massive social withdrawal, the effect on my sexuality was really destructive. I became ashamed about being gay, about being sexually attractive, and about having sexual desires. It was like going back in the closet, right? So this doubting, blaming ways that even queer and trans folks may enact homophobia inside their relationships. This next slide is really important when we're doing work, I think anywhere, but especially like to acknowledge in queer and trans community, we're a really, I think you called us beautifully diverse community. And so we really want to touch on the term intersectionality. And this comes from Black and Indigenous feminists to sort of acknowledge the history of the term. And what it asks us to do is that if we're thinking about how queer and trans people are targeted, we also need to be thinking about other aspects of their identity or their experience that might also be at play in a relationship. So I like to use the example of like an intersection. So you're trying to meet someone and they say, meet me on Main Street. You don't really actually have enough information to know where they're at. You don't know the intersection of the street. You don't know what time. It's pretty limited. So to extrapolate from that, to know where someone is in our culture, we need to know more than just their sexuality, more than just Main Street. We need to know things about their race, their class, their ability, and different systems that may impact them. And these systems create power differentials where some identities or experiences are less valued and can be more easily targeted in different ways inside of relationships or as people access services and supports. We're not going to go over everything on this slide. You do get the slides at the end, but there's just a few we wanted to highlight. So one would be ableism, which is a system of oppression that produces inequalities based on disability. And this can play a really big part in intimate partner violence, especially if someone is quite dependent on their partner for care or support, or even just access to their healthcare needs. But it also can impact how someone accesses support and how, if the services available to them actually meet their needs based on their disability. Colonization or colonialism, which is a system or practice of domination involving subjugation of a people here on the land called Canada, that's Indigenous folks. And this really prioritizes certain people and certain cultures as being true. So even when we're talking about two-spirit, to really resist the urge to try and fit it into our model or like a more Western model of gender and sexuality. But this also impacts people's relationships, right? If we're thinking about internalization, the stories we've been told of who deserves violence, who doesn't, colonization plays a huge role in that. And it also impacts people's access to support, especially when they're, maybe the institutions or organizations who are offering support have historically been involved in colonization. So if we're thinking about churches or certain organizations, it may just feel completely impossible for someone to access support there. And the last one I wanted to highlight was immigration status. And this can be really important because it is like sort of like another way that you may be outed. If your partner is threatening that you can be deported, or if you call the police, they're going to check your ID and they're going to know that you're, you know, not legal or you're not a citizen, and that may put you at risk. And so this also plays a role in like making people more vulnerable, or like making specific ways they may be targeted in intimate partner violence.
So in addition to all of those intersections Daley just covered, there's additional social context to the violence that is occurring. And there's a climate of silence that surrounds intimate partner violence in general, and there's an added layer of silence within LGBT2SQ relationships. So there's myths that surround IPV, such as that it does not exist, or that women cannot hurt each other, or boys will just be boys. And with this, there's been a normalization of violence. So whether that's if there's alcohol or drug use, previous histories of abuse, a lifetime of discrimination, these circumstances do not cause the violence, but they may contribute to the minimization or the normalizing of its severity. And there's a possibility that perpetrators may target their partners by using this. So for example, saying, I've had a previous experience of violence, and so therefore I'm not responsible. It's important to note that relationship dynamics can be very complex. Some queer and trans people describe a predictable cycle of violence, which can intensify over time. Others describe a constant pattern of abuse rather than a cycle. And in other cases, there does not seem to be a pattern and the violence occurs infrequently. So it's very important to check in with the survivor to see what their experience is. Daley already mentioned using isolation. I just want to add to that there may be an existing isolation if someone had left home due to discrimination, that they haven't had social support. And there's an added vulnerability that comes with being in your first queer or trans relationship. And this may be that you may fear losing the relationship, that if you don't have this relationship, then you lose your identity along with it. The perpetrator may be way more connected to other queer and trans and two-spirit folks, and they may act as a gatekeeper. And they may also explain their behavior as what would be termed normal. So saying this is just what gay sex is, and using that lack of knowledge about what is normal within LGBT2SQ relationships. They may have internalized the myth that IPV does not exist, and then therefore they may really lack the language to name their experience as violence. There's also a fear of betraying the queer and trans community, that there's already so much stigma and discrimination that they fear that if they'll speak out about their experience, that this will be perceived as negatively to the greater community. And there's two quotes we've selected from Tales from Another Closet that illustrate these points. So this one comes from Ruth. I didn't go and seek any support services because I didn't think of what was happening was domestic violence. And from Kent, I did not think of my experience with Jason as domestic violence. So these are individuals who have experienced quite extreme violence within their relationships. And if you are wanting to read their stories in full, I encourage you to, we can share that link out. But that it's really difficult to name what is happening, that there's a denial and erasure of that experience. So now we're going to move on to talking a little bit about the healthcare system. So healthcare providers may not ask about relationship violence, and LGBT2SQ people may not disclose their identity or experiences. So for example, let's say a queer couple enters the ER and one of them has a broken arm. If healthcare providers do not perceive them to be in a romantic relationship, they would not consider any physical violence, and it may be easier for the perpetrator to convince them that they're just roommates, etc. However, if a heterosexual cisgender man and woman entered the ER, that may raise some flags, and they may take one of them aside and ask more questions, but that may not happen within queer and trans contexts. Overall, trans and non-binary people face barriers to accessing healthcare in general, and then particularly gender-affirming healthcare. So what that means, gender-affirming healthcare, is mirroring their language, being very knowledgeable about specific issues, asking respectful questions. So not asking questions out of curiosity, but instead explaining why it's medically relevant. Maintaining the patient as the center and being considerate of that, and also being aware of trauma that may have occurred and maintaining that in your care with that person. People may not disclose what's happened to them because they have not felt safe from accessing healthcare systems before. They've had negative experiences, and then going forward and disclosing that they're experiencing IPV may be an additional barrier. So things to keep in mind. When talking about the criminal justice system, knowing that only 3% of domestic violence incidents, which are underreported generally, but only 3% are actually involving same-sex partners. And that calling the police can be unthinkable due to historical and current discrimination within the justice system. And if you have witnessed violence, it's important to check in with the victim and see if they wish to call the police, and know that third-party reporting is available for sexual violence, Charges are less likely to be laid in queer and trans contexts than they are in heterosexual domestic violence cases. There's a lot of myths and assumptions that surround this topic, which we've talked about briefly, and this can lead police to arrest if they enter a scene to not understand who might be the victim or who might be the perpetrator. So this might lead to dual arrests, no arrests, and or arresting the victim. And trans people, particularly trans folks of color, report high rates of discrimination and abuse among police. There was a survey done, the National Transgender Discrimination Survey, and they found that 1/5, so that was 22% of respondents who have interacted with police reported harassment by the police due to bias, with substantially higher rates, 38% reported by respondents of color. And half of the respondents reported that they were uncomfortable seeking police assistance. So this speaks to the lack of safety they feel about getting police involved in an intimate partner violence situation. Victim services. Services are typically designed to address cisgender men's violence against cisgender women, and these may not be responsive to LGBT2SQ people's experiences of violence and abuse. Service providers may not think to ask about gender identity or sexual orientation, so making those assumptions, and this can lead to a lack of safety for survivors to share their pronouns, their partner pronouns, and type of relationship. And there also is often a lack of knowledge or confidence to support LGBT2SQ survivors. This is another quotation from the Tales from Another Closet, and this one comes from Ruth. And she speaks about the overall cultural change that needs to occur. We need a culture that supports the development of women, lesbians, with a robust sense of self, a strong sense of self-respect, and a sense of their right to non-coercive, non-violent relationships. We also need legal systems, health services, and personnel that are well prompted and well equipped to deal with same-sex domestic violence. So now I'm going to talk a little bit about risk assessment and safety planning. And as we mentioned around statistics, there's also limitations of risk assessment tools, as these are designed for heterosexual cisgender relationships, and it's important to keep that in mind. Acknowledge that disclosing gender-based violence and reaching out for help can be risky, and that accessing support and response systems may re-evoke previous feelings and experiences. So being mindful of that and asking respectfully and normalizing that can really create the space for folks to come out and talk. Discuss previous experiences and fears with respect to support services and response systems. So knowing what we know about the criminal justice system, health system, victim services, that there may have been a negative experience, and to normalize that and ask questions. Respect confidentiality concerning gender identity and sexual orientation of the survivor, as well as their partner. So if you're connecting someone with another service, perhaps they don't want their gender identity or sexual orientation to be revealed, and to ask and have that conversation with that person about what they feel safe with and what they don't. And finally, safety planning. Making sure you're considering ex-partners, access to community, chosen family, and any alternatives that may be available other than health and police intervention.
So we've covered a lot so far. We've talked about terminology, we've talked about prevalence, we've given you sort of the social context and common barriers for accessing services. And now we want to give you some tangible, well, what do I do now that I know these things? Because we want you to feel like you can actually start to enact this, right? Go beyond language and actually be like, what might change in my practice as a way of being more accessible and more affirming to queer and trans people? So we're going to do a few different considerations that you can put into place. So first of all, specific to your client, things to consider about their name. So don't assume that the name on someone's paperwork is the name that they use, especially with medical records. So not assuming that what it says on your screen or on your paper is the name that they use, and ask folks. So like, what name would you like me to use for you? And really centering that the name that someone uses is their name and that their legal name is their legal name, but like really validating that the name they use is their name. Pronouns. This is one that often stresses people out a little bit because it feels a little foreign, but I really want to affirm that all of us use pronouns, and that's a really great place to start. And if we don't use pronouns, it's usually very, very explicitly don't and only go by our name. So for me, when we're doing pronouns, I always say, start with yourself. Share your pronouns. Hi, I'm Daley. My pronouns are they, them. What pronouns would you like me to use for you today? Make sure that you also ask about partners if it's relevant. And really to acknowledge that little word we stuck in at the end, which is today. We talked about gender identity as being fluid, and that pronouns can also change over time. And that has nothing to do with the legitimacy of someone's gender identity. It's actually just the nature of gender identity itself. Another important consideration is non-monogamy. So not assuming that all of the people that you're working with, you are in a monogamous relationship. And so like, just asking, so something along the lines of recognizing that there are a variety of relationship models. How would you describe yours? This is really important so that folks don't, we're not reinforcing stigma or assumptions that people make about the healthiness of different relationship models, but also you may be missing out on a giant area where they might have support by not acknowledging that there are other partners or folks in their life that they can who might be able to help them in this situation. So considerations for your agency. The first point I like to just call be explicit and be specific, which is, inclusion is a practice. It's not a state. It's like sticker, a rainbow sticker isn't enough. Folks really do their research when they're looking for support. And so for you to explicitly state your intentions or practices around inclusion and how you are putting them into practice. So an example would be, we're striving to be LGBT2SQ plus inclusive in the following ways. Give real specific and explicit examples of what inclusion looks like at your organization or in your practice. Hire staff who reflect the gender and sexual diversity of their clients and create an inclusive workplace to retain these staffs. So really reflecting the diversity you want coming through your doors and the people that work with you or in your organization. And really thinking about those social contexts we already mentioned. They don't just apply to intimate partner violence survivors, they apply to all LGBT2SQ plus folks. So what might actually have to change at your organization in order to retain and really take care and sustain your queer and trans staff? And then the other consideration is around competencies. Thinking about that intersectionality, the colorful slide we looked at, the more we can build skills across all those different systems, the more inclusive we will be of queer and trans folks. And so thinking about doing anti-oppression trainings, doing trans inclusion, but also doing things like trauma-informed practice to really acknowledge that people navigating systems of inequality have forms of trauma that need to be supported and engaged with, and being really explicit about it. Any of these competencies can really expand your capacities to support people. Some more considerations for your agency. So do you have queer and trans inclusive and/or specific, there's that word again that I love, resources and materials in your agency and on your website? So thinking about what are the specific needs, what are the specific resources to show that you're not just welcoming LGBT2SQ plus folks, but that you're considering us, that you're actually thinking about our needs and our situations, not just saying, come on in, oh, how do we support, but really show us that you've been thinking about our experiences. Offer LGBT2SQ plus inclusive and specific resources and programs. And this is where we can go back to that staffing of like, get queer and trans folks to develop your programs and your resources, and also have us evaluate them so that we know if they're actually meeting the needs of community or not. Forms and documents. This is my favorite, which is ridiculous, but it's really an opportunity where you get to show people on paper that you're thinking about queer and trans clients, and that you're thinking about how to make sure that we feel affirmed and welcomed in your space. So examples would be, asking for someone's name and then making another space for their legal name so that we can really center their agency and autonomy to name themselves or claim their name, while also collecting legal names if we need to. I really advise that you avoid checkboxes whenever possible and really give folks the opportunity to use their own words for themselves. And like within that avoiding checkboxes, really think about what happens if you use the word other as a checkbox and what's that tells folks coming in about who's a normal client and who's not. And the last one on this slide is increase privacy and safety in washrooms, transition housing, to increase access for LGBT2SQ plus survivors. I often give the example that sometimes when we're coming in to do these workshops, there's not even washrooms that I can use. And so like if you're telling folks that their very basic needs can't be met, what would it mean to like wade into some of the more complex needs we have as survivors? And really thinking about that, if disclosure can be really risky, how do we make it as private and safe as possible so people can actually share who they are and get the services that they need based on their, being as out as is comfortable for them. The last slide of considerations we want to cover is about sort of the community level. And firstly, it's to acknowledge that there are few queer and trans-specific resources and services. So it's really great to be knowledgeable about what there are. But also, if you're not sure, we always recommend like making a phone call, like check in with the folks before you refer someone, and just sort of like actually see what's available, how long wait lists are, things like that. So just really doing that extra little bit of labor for your clients. Also acknowledging that support is not always accessible, affordable, or safe, and really listening to your clients about those, what might not feel or be accessible for them. So being mindful about the ways that LGBT2SQ plus folks and QT BIPOC folks may have been treated by service providers in the past, and keep in mind that folks may not feel comfortable or safe accessing some services. Other examples would be, referring someone with a disability to a place that isn't physically accessible, so low-cost counseling that's up a flight of stairs, or, referring them to a therapist who's very expensive and not really checking in about what can people actually afford. So thinking about those intersections of disability, class, otherwise, around what supports are available. And finally, we had touched on this before, but it is really important to affirm that survivors may not disclose. that disclosing gender identity, sexual orientation, and/or experiences of intimate partner violence may be risky for some folks. And so, like, not to force folks to disclose, also to, if you're referring out, to make sure that you don't out someone without their permission, and really center their expertise in staying safe when you do that work. So before we move on to some questions from all of you, we want to take a little bit of time to ask you this last question, which is, what is one thing that you learned today that you can take away to increase your ability to support queer and trans folks experiencing relationship violence and abuse? So one thing you learned that you can take with you, and I would push you to add in what you're going to do with that one thing that you learned. And we'll give you a little bit more time. So we'll give you about 45 seconds to think about it.
And before we get into questions, we want to end with a quote. And this comes from Alice from the video Broken, which was specifically about their experience of domestic violence in an LGBT relationship. I was never the problem. I was a victim of domestic violence in an LGBT relationship. I became stronger. I became better. I became me again. Piece by piece, I became whole again. And so now we really invite you to type some questions into the chat box, and we'll give you about 30 seconds to think about that, and we'll be going through them in just a second here.
There's one question that came in. Does Victim Services receive LGBT2SQ plus training and education? This is Kate speaking now. There's certainly quite a variety of opportunities for training, and I think very much this Safe Choices program is sort of an anomaly. We've been around for over 20 years, but with a very small program funded by Vancouver Coastal Health. Very grateful to have that funding to sustain this training for service providers. But in terms of long-term, core funding or sustainable funding for training, I think it's very difficult to get, funding in general for training, and then particularly around this specific topic. So again, very grateful to the Ministry of Public Safety and Solicitor General through a Civil Forfeiture Grant that we were able to reach beyond Vancouver Coastal Health this year. But again, that funding, we are always looking for funding to do more. And I don't know that there is any other entity locally that has a continued program such as this, providing intimate partner violence, relationship violence training and education for this community within BC.
So we have a question about how to address disclosure safely on documents. For me, this is where we really center the people that we're working with. And for me, before anything goes in a document, I ask the person that I'm working with. I know that there are some ways that we're asked, like requirements of the information we collect, but to really center someone's agency. I think this is important whenever we're dealing with intimate partner violence, that we really affirm people's rights to keep themselves safe. But again, to just like, before you document it, make sure that you're getting their permission In the medical clinic that I work in, our form actually says if there's any information you don't wish to disclose, please don't. So really acknowledging that they get to define what's best for them in relation to disclosure.
We have another question, which I think is really important and want to address. Someone says that they identify as cisgender, straight, and they have a lot of connections to the LGBTQ community, but there's some concern that if they have a client from this community, that they may cause some harm out of an ignorant comment or not meaning to, but saying something just by not knowing. And how might they approach this with this client? Or then should I make a statement about my competence or incompetence from the beginning? And I think this is a really excellent question, is that, and very common as well. And first and foremost is to understand where you're coming from. What's your intention? And from this person, it sounds that it comes from a very good place, and there's some fear around making a mistake, and that's okay. Daley and I have had a conversation before, and we say that we misgender ourselves sometimes, is that there's so much in society and so much heterosexism, cissexism, that it's hard to remember all the time, and ultimately it comes from what your intentions are. So asking respectful questions, and if you ever do make a mistake, if you use someone's pronouns incorrectly, say sorry and move on quickly, instead of focusing on it and making that person feel like they need to dismiss you or say it's okay, and instead just acknowledge that, like, oh, my mistake, and continue on.
Yeah. And I would recommend, like, whenever you can take on the labor of education and take it off your clients, that's really great. So if an example is that you make a mistake or something comes up that you don't know, first of all, naming that you don't know it can be really valuable. Letting someone define that term for themselves, because even within queer and trans community, myself, I'm always asking people to define that word according to them, because there is a lot of diversity in definition, but then also taking on the onus that, like, my client has so much on their plate already. I'm going to go and do some research into that term, into that knowledge. We're shared a resource list, like looking and finding other ways to learn, so that you can really acknowledge that, like, it's not necessarily your client's work to educate you, but you're really committed to learning more and getting better.
Yeah, and not letting that fear stop you, and not preventing that from taking on a client who's from that community. Is really important to continue to include.
There's another question here about agency names. And so for programs that are for women only and are women's advocacy programs, and their funding covers trans women, so how can they make their name more inclusive? And so I would really point you towards other anti-violence agencies or organizations that have shifted from their name including women to more inclusive language and names. So 2 organizations in BC that have done this or are currently in this process are Victoria Sexual Assault Service Center, and they have a number of resources on their website. And in our resources and links document, there is a link to a document that might be helpful in that regard. And then Waiver Rape Crisis Center has also over the last few years undergone a process of transitioning their program to a more trans-inclusive agency and developing trans-specific programs. So I would point you to those 2 centers for some resources and support around changing your mandate or your name.
We have a question about how to make bathroom facilities more accessible, comfortable, and safe. So first of all, for me, if we're thinking about the intersections, we want to talk about physically accessible washrooms, that we have washrooms that folks with different physical abilities are able to access. But there's also some ways that we can be, again, that sort of sense of explicit and specific, so that we really name that everyone is welcome in the washroom. There's a few. So single stall washrooms can be really helpful if folks don't feel comfortable based on previous experiences of going into washrooms. So if you have them, making sure that your single stalls are gender inclusive. Another is to actually name that, like, trans people are welcome in a washroom. And so actually saying that, so that there's some, like, very clear and explicit naming of that washroom. And then last, I think it's about training. I'm about to cough. And really like training your staff on how do you respond if there is a concern around washrooms. Like, how do you really center the safety of trans folks? And I think often the stories that get told about trans folks in washrooms are that the other people accessing the washrooms are the ones who aren't safe, when really we see in numbers and statistics that we really need to center the safety of trans and gender diverse people. So sort of switching that script and then actually talking about, as an organization, what do we do if something comes up, so that you actually aren't just winging it, but you can be explicit that you have a procedure if there's a concern about washrooms and gender.
There's a question that's come in around how to support or how to talk to other clients, because I've heard this certainly in many of our service provider trainings where staff are on board and inclusive, and they struggle with other clients who might not be as open. And so the question is, how do we support trans, non-binary, and two-spirit people in spaces where other people, again, similar to the bathroom question, I guess, other people might feel uncomfortable. So group therapy or support groups, possibly in shared housing kinds of situations.
There's quite a few different ways that we can approach this. The one thing I want to start with is making a distinction between someone being uncomfortable and being unsafe. And that isn't to dismiss how someone's feeling, but to just be aware that people sometimes might be uncomfortable, and that's really different than being unsafe. But for me, one of the important things is that all the people that we serve know what they're saying yes to. So that if you're joining a group, you know that the group includes if it's a group for women and it includes trans women, people know that when they're saying yes, or if they're going to housing or otherwise, that they know. So sort of putting the onus on the cisgender person or the straight person to know that they're saying yes, and that they're going into a space where these people are going to be welcome. And so that we're not necessarily pitching curveballs, but we're also making them, they're consenting explicitly to that. I think also there's an opportunity for education. I don't think that most people come at this in a negative sense. It's just a lack of knowledge. I like to give the example that I literally am trans and didn't know that trans people existed till I was 24. And so there is opportunities to build connections and alliances if we really recognize that all of us are unlearning the systems that we grew up in that may give us certain value statements about trans folks, gender, who deserves support or who's safe and who's not. So there's a really big opportunity to do some big shift work if we support folks in feeling uncomfortable in ways that are still safe for them.
There's been quite a number of questions about transition houses and shelter spaces. So as most of you probably know, the BC Society of Transition Houses is the umbrella organization for all transition houses, safe homes, and second stage and third stage housing in BC. So I would look to them for guidance. I know there are some resources specific to shelters, and I can certainly dig those up for folks that are, I think, from other jurisdictions, possibly even the United States. But there are a few resources out there to support with any questions you might have around that. And then I would also encourage you to reach out to BC Society of Transition Houses for some support and to have some of those conversations as well.
We have another question about that it can be sometimes hard for the victim to recognize that they are in fact the victim rather than a mutual perpetrator. And sometimes this could be actually used as a form of abuse, is that the perpetrator has convinced them that it's a mutual abuse situation. While this is possible to occur, it's important to know that at any particular instance, there is always a victim and a perpetrator, and to sort of understand that client's experience and find the times in which they are being targeted. And something that can be useful, and I found useful in working with clients, is using that power and control wheel and sort of seeing it on paper to sort of identify. There's also some checklists that are available and sort of go through and see what they may be contributing to or being targeted to, and help them understand that. And the last piece we want to speak to is in rural and remote communities. That there are queer and trans folks that are in these communities, and that it's extra important then for services to be inclusive and to talk with these people and see what kind of services they need, and just being aware of how limited it is. We've shared a file of resources and some readings that you can go through. We're also going to send this out after the webinar is complete.
One of the questions that we had was around supporting polyamorous clients. And my response is a little bit of a caution to set there being a certain way, but really thinking about that there are dynamics that show up in polyamorous relationships, and really, again, thinking, there are often tools that people use in other relationships too. And that often when we're supporting folks around intimate partner violence in polyamory, it's like often specific to one relationship, and we can think about it in that way in some ways. But yeah, thinking about like jealousy or boundaries, I think a lot of what applies to monogamy also exists in polyamory. And that to really resist the myth that polyamory is this like anything goes kind of situation. And also to resist, I know sometimes when people are trying to be supportive of polyamory, they'll like not pay attention to the red flags in it, and abuse happens in polyamorous relationships in like all of these spaces. So just being really aware that a lot of the tools we have apply, and like also to use that sense that you've been developing if like something really doesn't seem right. The label of polyamorous doesn't mean inherently bad or some magical form of relationship that has no harm, which I think was a myth that was told about queer relationships and like gay and lesbian relationships for a long time, that there would be no harm. So I guess the answer is there isn't a specific way to deal with them, but sort of to pull from what you know, and also be cautious about the stories that you tell about what a polyamorous relationship looks like.
So thank you all for being with us today, and also thank you very much to our funder for making this webinar possible. If you do have any further questions, really encourage you to reach out. Kate can be contacted by the email listed there, as well as the phone number, and we will be sending you a evaluation very shortly here. It's quite short, and we'd really appreciate any feedback you have, and this will help us inform future trainings. You'll also receive a list of resources, the slides. Yeah, so thank you very much, and that's it from us.
Okay, thank you everyone. Have a great day.